Client rights and responsibilities. Clients have rights and should be treated as such. They provide an ethical code of conduct for healthcare workers to follow. Home health agencies provide a list of these rights to the clients and review each item with them. The Client Bill of Rights. The Client Bill of Rights includes the following. Clients have the right to dignified, considerate, and respectful care. Clients have the right to be fully informed on the goals of care. Clients have the right to participate in care planning. Clients have the right to confidentiality. Clients have the right to the highest quality of care. The right to dignified, considerate, and respectful care includes the right to not be discriminated against based on race, religion, national origin, age, gender, sexual orientation, or disability. The right to mutual respect and dignity, including respect for property. The right to be aware of how to lodge a complaint with the home health provider. The right to voice grievances without fear of discrimination or reprisal or punishment for having done so. The right to not be neglected or abused. Neglect and abuse. Neglect means failing to provide the care that the client requires or the basic necessities of life. Abuse means purposefully causing physical, mental, and emotional harm to someone. Verbal abuse is the use of words that are hurtful or disrespectful. Physical abuse is causing physical injury to someone. Sexual abuse is forcing a client to perform or participate in sexual acts. Remember that due to the power imbalance between the home health aide and the patient, there is no situation in which the client can consent to sexual acts. Psychological or mental abuse, that is behavior that causes the client to feel threatened, fearful, or humiliated. Financial abuse, that's when you steal money or property of the client. Home health aides must never abuse clients in any way. They also have a duty to protect their clients from abuse by other people, including the client's own family. If you suspect that a client is being abused, you must report this to your supervisor right away. You have a duty to report abuse. Many times, abuse occurs as a result of increased stress on the family from an illness. When caregivers are burnt out and desperation sets in, they may act in ways that they would never have imagined. Reporting abuse can sometimes be a blessing to the abuser as it saves them from a terrible situation. The right to be fully informed of care. Clients have the right to be notified in advance about the care that will be given and the types of caregivers who will give the care, to be advised of any change in the plan of care, to participate in planning the care, to refuse the care without fear of reprisal or discrimination, to be notified of the expected outcomes of care and any barriers or obstacles to treatment, and have healthcare providers comply with advance directives. The right to receive the highest quality of care. The client has the right to receive the highest quality of care by the most appropriate care provider. They also have the right to be admitted by the home care agency only if they have adequate resources to provide the care. If more appropriate care is not available to the client, the agency can provide the care, but only after informing the client about the provider's limitations. The client also has the right to be told what to do in an emergency. The home care agency must provide care according to the physician's orders, provide care by an appropriately trained home health aide who is supervised by a nurse or other qualified home health professional, and the client has responsibilities to notify the agencies of change in their condition, such as if they're hospitalized, if they have new symptoms, or if they need a change in their plan of care. Follow the plan of care. They also have the responsibility to notify the agency if changes are needed to be made to the visit schedule. They must inform providers of changes to any advance directives and advise the provider of any problems with the service provided. They also must provide a safe environment for the care to be performed. The agency also has responsibilities. To satisfy the Medicare certification requirements, the Centers for Medicare and Medicaid Services requires that agencies provide a copy of the Bill of Rights to each client as part of the admission process, explain the Bill of Rights to the client, and document that these things have been done. Many agencies have the client sign a copy to acknowledge receipt.